Mother and Baby Care, Unit 6. As a home health aide, you're going to be going into a patient's home who maybe has just had a baby because the baby has some special needs. Maybe they came home on oxygen and mom and dad need some extra assistance, some extra information, some extra education about how to care for the baby. You will not be the one necessarily giving that education, but you will be in the home assisting mom with the baby. The majority of the time, you're probably going to not be taking care of the baby. Mom needs to create a bond, and you need to promote creating that bond with that baby. So your task as a home health aide in the home of a newborn with mom is to promote mom and baby's bonding. So you are going to be doing some of her work. You're going to be doing the laundry and making the meals and cleaning up and doing kind of those types of things, more housekeeper type things, and then just being there as an extra set of hands and an extra set of eyes for mom. Here's a little comic for you to read. Also, the mother with a newborn, there's a lot of hormones, a lot of emotions. She may be crying, she may be irritable, she may be happy one minute. It's just going to go back and forth, and it's just those surges of emotion and hormones that are running through her body. Make sure you're communicating with the mom and letting her know that that's okay. It's all right to feel that way, and if she sleeps enough, if she gets enough rest, that's why you're there to help relieve her of some of her other duties so she can get better and feel more rested and be able to care for her baby on her own. The first 6 weeks is called postpartum. For mom, all organs will begin to return back to their non-pregnant state, and by 6 weeks they are completely back. You need to be checking mom for signs of infection, if she's got an elevated temperature, if her breasts or abdomen are painful, if she has an odorous discharge. The discharge is called lochia after the birth of a baby. It should be dark red. It could contain several clots for 2 to 3 days, pretty large clots sometimes, but those should decrease over time. She should never report, or she should never have more than 2 soaked pads in 1 hour. If she does, you need to let your nurse know that something is wrong. She'll bleed for probably a month to maybe a month and a half. If longer than that, you need to make sure that you are notifying the nurse about that. So moms who are breastfeeding need to take care of their breasts. Soap and water, they need to be cleaned. The nipple's going to be sore. You should understand that it may crack. Baby needs to latch on. You need to understand how the baby needs to latch on and take the entire nipple and the areola, kind of the whole darkened area, rather than just the nipple itself, because that would be very, very painful. Mom needs to drink plenty of water, no alcohol if she can prevent it, water, and have a really good diet. She needs to be eating so that she can continue to feed the baby. These are some signs and symptoms of breast or nipple infection. So you need to make sure you're letting your supervisor, which is your case manager, your nurse, know if any of these signs are being reported to you by the nurse or by the patient. Breast milk has infection-fighting properties. People say, breast is best. You know what? Fed is best. That's what's best for the baby. So if mom if mom wants to breastfeed, encourage her to do that. But if there's an issue or a problem, make sure you're notifying your case manager so that they can get a lactation consultant in there to help with the baby, the feeding. But it is okay if mom doesn't want to breastfeed. It is okay if mom has to make a change. You should not encourage her one way or the other than encourage what her desire is and help her through that. You should not impose your particular wishes or desires on the mom. If you're preparing a bottle for the bottle-fed babies, this is kind of how you need to do it. You need to make sure your hands are clean and washed. Babies are born without an immune system. That is the benefit of having a breastfed baby is they continue to get mom's immune system, but it takes a little bit for the baby to develop their own. So you want to limit the amount of infections and pathogens that you're giving to the baby by not washing your hands and not making sure things are sterile. This is how you would use or how you would sterilize the bottle. You can see they're boiling the bottles with the nipples. So you'll want to do that, but this just refer through here so you know how to prepare a bottle for feeding the baby. When you go to feed the baby or when mom is feeding the baby, make sure the hands are washed. Mom needs to be comfortable. Whoever's feeding that baby needs to be comfortable, whether bottle or breastfed. If you're not comfortable, the baby's going to pick up on that and they're not going to feed like they should. Don't prop a bottle. The baby should always be held when they're being fed so that you can see if they're choking or if they're having problems. Because sometimes the nipple will have too large of a hole and too much milk goes down for the baby, and so they could choke to death. So you need to always make sure you're paying attention or mom is paying attention. Never put formula or breast milk in the microwave. It should always be heated up to room temperature, and you should, if you do, when you do heat it up, you need to test it on the inner aspect of your wrist, because that's the softest, most sensitive part of your body. So you'll be able to see if it's too hot. You don't want the baby to drink hot milk. You'll burp the baby after every 2 to 4 ounces. Newborn babies may not drink. I mean, they may drink a half an ounce and then need to burp. So you're going to figure out what's right for the baby, and you're going to talk with mom and help her through all of these things. If the baby's not eating, even if they haven't drank the 4 ounces or however much you prepared, if they could stop eating, try to burp them, pat their back, lay them on their stomach, something to try to loosen up the gas inside their abdomen. And after they have eaten, then change their diaper, put them on their back. Don't lay them on their stomach. That's now not necessarily something that we should be doing. When you're bathing, if the baby still has their umbilical cord, do not submerge them in water. You need to do just a sponge bath, just the washcloth on the outside. There is a video that you need to watch on how to bathe a baby appropriately, so we're not going to go in here. But make sure you never, ever, ever leave the baby unattended. And if the cord has not fallen off, do not submerge that baby. Make sure... So I'm not going to go through this because you're going to watch that video. Care of the umbilical cord. So the umbilical cord will be on for anywhere from 3 days to 2 weeks after they have been born. So it'll become dark and brittle. Do not pull on it. Do not anything. But you do need to clean around it with an alcohol swab, according to the care plan, which is typically every day or every diaper change, possibly, that you're cleaning around the base of that cord. If it drops off, if it's foul smelling, then you need to report that to the nurse. Anything that's abnormal. If you have a little baby boy that you're taking care of, and he has had a circumcision, you need to pay attention to the tip of the penis and make sure it's not getting infected. Change the diaper frequently. It's going to be tender and it's going to be sore, so you need to be very careful around that. Diapering a baby, definitely wear gloves. You want to change them every 2 hours minimum to prevent diaper rash. If they start getting little red dots on their bottom, then that is diaper rash. There is some creams that mom could choose to use. As long as it's in the care plan, you can do that. But make sure you get, if they've had a bowel movement, you get all of the feces off of their skin, because it will start to break down their skin. You can use soap and water, or you can use baby wipes. The first couple of days after a baby is born, they're going to have a dark stool. It's meconium is what it's called, and it's thick. It's almost like tar. Completely normal for the first couple of days. If you have a breastfed baby, the stools are going to become kind of a mustardy yellow and kind of pasty. If they're formula, they're going to be like normal bowel movements for adults even. Kind of solidish, brownish in color. Could be a little bit yellow, but breastfed's always going to be a yellow color, so that's what would be normal. If the baby is being diapered in a cloth diaper versus a disposable diaper, it will be your responsibility to clean those as well. So you rinse them out kind of in the toilet, get all the stool off of them, wearing gloves obviously, and then you'll throw them in the washing machine. If you have any questions about that, talk to your nurse that is in charge. Safety precautions for your infant. Don't place, basically you don't want to impede the face, so their airway, because they're not going to be able to move their head or anything like that, so you need to make sure that their nose and mouth, that they are able to breathe at any time. Make sure you're not putting them in a crib that has open sides and putting them too close to the crib side to where they can get trapped in between the crib rails and the mattress. The crib rails always need to be raised. Stay with the infant whenever if you lay them on a couch or something that they can fall off of, if they can accidentally roll. Babies aren't supposed to roll over within a few days, but I've had 2 nieces that rolled over 6 days after they were born. So it can happen, and so you need to never leave that baby unattended in an unsafe environment. Always put them in a car seat when traveling. Small objects, keep them out of sight. So you may have an infant that has just been born. You may have a 3-month-old. You may have a 6-month-old that you're caring for. So you need to appropriately assess what is safe for them and what is not. And what is not safe for them, you need to remove from their ability to reach. If the baby feels hot, don't ever take a rectal temperature. That's not for you to do because of bowel perforation, but this little strip that's on there is called a Therpa-C-Dot thermometer, and it's just placed on the skin. It's one-time use, and it'll tell you how hot their skin is. If they have any of these symptoms whatsoever, you need to know this. You need to call the nurse right away because this is an issue for the baby, and you need to make sure that they're being taken care of. If you notice an infant that is lethargic and tired and just doesn't seem to want to feed, notify your nurse as well. Also, if you notice any bruising or discolorations on their skin anywhere, you need to let the nurse know ASAP. So any questions on that, please send them to me via email or Blackboard email, and be sure to watch the video on how to bathe your baby. Thanks.